Welcome. In this video, we will discuss the SKED Stretcher. The SKED Stretcher is carried on most frontline engines and rescue squads. It is a dependable, versatile piece of equipment that has been in production for the past 33 years. Historically, Montgomery County Fire Rescue Service has used SKED Stretchers during snow events, but hopefully, after the video, you may realize more usefulness in your daily operations. SKED uses and history. The SKED is not an acronym. It came from fusing the word sled and skid. Initially, the SKED, measuring 3 feet by 8 feet, was used by hunters to tote harvested wild game back to their camp or vehicle. It has since morphed as a life-saving device that's used all over the world, including in the military. Most recently, the SKED was used to move equipment and people through the Thai cave-in that occurred July 2018. In this video, we will discuss the inventory of the SKED Stretcher, patient-person packaging, drag techniques, and a quick view of manufacturer-approved lifting techniques. The entire pack can be conveniently carried on your back and includes 2 D-rings to raise or lower the SKED pack to the patient's location. The SKED bag inventory includes the SKED bag, 30 feet of 3/8-inch static kern mantle rope with a pre-tied figure-8 knot that should never be untied, and 1 steel locking carabiner, 4 extra slip handles, 1 toe strap with 2 handles, 2 lift slings or straps. 1 is 7 feet long, 1 is 6 feet 6 inches long. The shorter sling is labeled head strap, so the user can identify and correctly apply the SKED to the patient in a slightly head-up position. To ensure proper fit within the bag, the SKED device is secured and stored with a strap around the middle. You will need to remove the strap and unroll the SKED before use. The SKED Stretcher has a memory, and you will need to roll the head and foot in the opposite direction of the coil to fully flatten the SKED device for packaging. Placing a patient onto the SKED Stretcher. This smooth surface allows for the person or patient to be positioned in place with minimal effort or discomfort. Position the person or the patient's shoulders where the SKED device tapers. This will assist in preventing the attached SKED device straps from crossing over their neck. Utilize the most appropriate means to transfer the patient or person onto the SKED device, such as the log roll method or lifting the patient and sliding the SKED device under them. When applying the SKED, consider patient comfort. Remember, keep the person warm and apply a blanket. Secure all 4 cross straps straight across to its corresponding cobra buckle. Securing from the lower legs up to the chest in a distal to proximal fashion. And remember, do not attach the straps diagonally. This will result in the SKED device bending in the middle. And remember, make sure the SKED clip straps do not secure at the neckline or directly over the throat. This will prevent a choking hazard. For the feet wrap, bring the bottom strap up through the unused grommet and back to the cobra buckle. Depending on the patient's comfort, the straps can either be in the middle between the feet or on the outside of the feet. Both methods are acceptable per the manufacturer. One or two person drag. The 3-person drag using the lift sling and strap combination. The 4-person carry using the 4 webbing handles. Please note, the 4 webbing handles are threaded from outside to inside. The 3-person drag using the toe strap. When using the toe strap, care should be used to make the attachment at even positions, using the loops created by the permanently sewn patient straps. The 3-person drag up a hill. Securing the patient's head into the SKED device with the drag handle webbing. Always finish by tying a safety knot. The SKED horizontal lift. To prepare for this lift, take the attached yellow towing handle and tie an overhand knot to one of the straps in the patient's waist area. Tuck in the handle so that the strap does not hang outside the SKED, and if possible, don't forget the safety knot. Take the 6-foot 6-inch long head strap that is marked head strap and insert it into the angled slots of the SKED from the outside in. Do the same thing with the longer sling at the foot end. Make sure the strap loops are married together at equal length. The steel carabiner is then used to provide a 1-point hookup. This carabiner should work smoothly when open and closed. Don't forget, lock the carabiner. The SKED vertical lift. To do the vertical lift, take the 30-foot 3/8-inch static Kernmantle rope and pass it through the grommet at the head end. Pass it through the shoulder. Don't forget to leave about a foot or so of rope at the head end for lifting. Pass the rope through the attached handles and through the grommets from outside to inside, in effect weaving the Kernmantle rope all the way to the foot. Do the same thing on the other side, leaving the same amount of rope at the end. Tie the rope at the bottom into a square knot. The two free ends of the rope are then passed outside in through the lower attached handle straps. Secure the ends of that rope. Finish this by tying the handles together with a square knot and the required safety. When doing vertical lifts, however, consideration should be given when dealing with any person or patient that has an injury to the lower extremities. Standing in the vertical position will only add more injury, and therefore the vertical lift should not be used with this type of injury. And as a reminder, a system for hoisting must always follow what is outlined in the PSTA driver training program for aerial drivers. Hopefully you've enjoyed this video. Remember, this video is a general instructional guide, and use of the SKED system should always be done with local medical and training protocols.